They say the eyes are a window to the soul, but they're also a window to your overall health. For those living with diabetes, eye health is especially critical. Here to shed light on the connection between diabetes and eye diseases is Dr. Peter Tang, Assistant Professor of Ophthalmology at MUSC's Storm Eye Institute. Dr. Tang, thank you for being here with us today.
Thank you for having me.
Can you expand on how diabetes has such a direct effect on the eyes?
So the diabetes itself is a disease of the entire body. And a lot of times what we see in patients with diabetes is that they have a lot of issues with blood flow. And when you have problems with blood flow, they can definitely manifest within the eyes and cause a lot of vision problems.
What are the most common eye diseases that you see?
So eye diseases that we see in diabetes span the gamut from the front of the eye to the back of the eye. So cataracts is definitely a big problem for that diabetics experience, as well as bleeding in the back of the eye within the retina itself. And so when these things happen, patients get scared, they come to us, and we try to treat them.
Are there any early enough warning signs for them to get in front of it, or are a lot of these insidious?
So a lot of the changes in vision can be very subtle. And if you're not super attuned to your eyes and to your eye health, it can be something that's easily missed, or oftentimes what we see is easily deferred until later, because a lot of folks with diabetes and eye problems are younger and they're working and they have lives that are complicated and busy and children at home that they have to take care of. And so when we do see patients with new patients with diabetes in their eyes, unfortunately a lot of times it's already very advanced.
How often should diabetics be getting eye exams?
For someone who's diagnosed with diabetes, whether it's type 1 or type 2, absolutely at the very least once a year.
Okay.
And if there is serious things going on or ongoing issues that we're monitoring, it would be much more frequent than that.
So when we're thinking about eye exams, if someone has, perfect vision, they might think they don't need glasses or contacts. Should it be a good idea for them to go and get an eye exam here or there, or is it not really necessary?
I would say that it's always a good idea to get your eyes checked. It doesn't necessarily have to be an ophthalmologist or a medical eye doctor. You can definitely get your eyes examined very thoroughly with optometrists in the community, as well as you can go to an optical shop to get checked out for contact lenses and glasses. And if there are any issues, oftentimes they would refer these patients to us here at Storm Eye.
So we've established that diabetes has a big impact on eye health, but what about other diseases? So when you're checking someone's eye, how often are you able to catch signs that there might be something going on?
So it's very often that we actually, as ophthalmologists, are the front lines to diagnosing some very serious problems that people may be experiencing without even being aware of. And so within the eyes, aside from diabetes, we've seen folks with uncontrolled blood pressure that have manifestations inside the eye. We see issues with autoimmune diseases where there's inflammation in the eyes that can be very serious. And we've even seen cancers that show up in the eye first from somewhere else in the body, and we're oftentimes the first ones to diagnose it.
Wow. Now, the Storm Eye Institute, you guys have great medical and surgical care for diabetic eye diseases. Can you expand on that?
So at the Storm Eye Institute at the Medical University of South Carolina, we have an entire repertoire of services that we can offer, everywhere from elective procedures all the way to very serious eye surgery. So we have, it runs the entire gamut from refractive surgery like LASIK surgery, cataract surgery, eyelid lifts, all the way to orbital trauma, eye trauma, retinal detachments. And so we are a one-stop service for everything.
Wonderful. Dr. Tang, thank you so much for being here. MUSChealth.org is where you can go for more information. Thank you again, Dr. Tang.
Thank you very much.
We're back in 2 minutes.